everyone and welcome back to my channel. My name is Deanna and I make videos about mental health and self-improvement. And in today's video I'm going to be making a video about advice that I would give a doctor that is working with a mental health patient.
And trying to remain so strong. I know it's good if I'm alone. I got it.
So why am I making this video? I am making this video because I have been subject to poor treatment when I was unwell with my mental health, and I want to share my experiences and what happened in those, be able to help improve the quality of care for those that are suffering with their mental health and are being treated from a health professional, whether that's in A&E or whether that's in a psych ward or therapy or any other sort of place where they're getting treatment. So this video is for any health professionals out there, whether you are actually in the mental health field or whether you might work in A&E or any other wards. Mental health is very, very common right now, so even if you are treating your patient for an ear infection, they may also have underlying mental health conditions, so this video is very important that you watch it. And also this video is for those mental health patients on how to advocate for yourself whenever you're receiving treatment from a health professional. So I'm going to start off by explaining some of my experiences in a brief way, because I do actually have videos over on my channel which do explain them in a longer form and in full context. But the first one that I would like to explain is a psych doctor. So I had a psych doctor, and this psych doctor was based in the main hospital within the A&E department, but he's there to assess any mental health patient that comes in to the A&E, and that he kind of almost assesses their mental health and decides whether they need to be admitted to hospital, to a psych ward, or whether they can go home. So just a bit of context, I was suffering really, really badly from my mental health. It was the 1-year anniversary of my friend's suicide and I needed help. I wasn't doing this. I wasn't doing all the symptoms I had for attention. I was doing it because I literally could not take the pain I was in, and I felt that I wasn't listened to. I felt that this doctor did not listen to me in one little bit. He walked into the room and he said, "So I'm not going to admit you, so you can just get that straight in your head." And that was shocking, because there is a policy within the NHS which says that the first thing, or at the beginning of a assessment, the doctors, nurses, whoever it is, health professional, need to say, "Hello, my name is." And that was a big thing that, would have helped in that situation, because he walked in and he just announced the fact that he wasn't going to admit me without even saying what his name was, and I felt that that was very poor treatment. So within this situation, upon talking to this doctor, it conspires that he had read my notes, he had seen that I had been diagnosed with borderline personality disorder, and he had taken it upon himself and decided that without even meeting me, he was going to just not admit me because of my diagnosis, which I feel is completely, unprofessional, looking at a diagnosis and letting your judgments take over and letting the research that was done, one piece of research was done to say that people with BPD don't benefit from hospital admission. And, I think it needs to be done a case-by-case situation. Yes, there's one piece of research, but I myself have had history when I've gone into hospital following very similar events, and I have benefited from the admission. So I think that he needs to, in a way, look at my history as well and not just my diagnosis, because, yeah, that was a bit unprofessional. So the second incident that I'm going to talk about is another doctor, and he was actually within the A&E department. So he was a physical health doctor who just saw me following a mental health episode. And in my notes, so this was a doctor that I actually did end up making a complaint against, but I do not regret one single thing about making that complaint, because he was something else. His attitude and his treatment towards me was very manipulative. And so after the fact, and after meeting him, going home from A&E, he wrote in my notes, "A difficult case from a manipulative patient." And I felt that that could have definitely been worded better, but also the way he treated me just kind of bundled it in to make me think that I definitely needed to do something about this and make him aware that his treatment was not great, and that, he should be thinking about how he actually treats his patients and also how he writes up the things in the notes. So for example, if he did want to write about the fact that I came across manipulative, he could have said something along the lines of "a difficult case from a patient displaying manipulative behaviours," and that would have been It still would have annoyed me because he's used the word manipulative, and if anyone else who's watching this video has BPD, you probably have had at least one time where you have been described as manipulative, and it can be used as a term that is just thrown around, and people describe people with BPD as manipulative. And I myself, I'm trying to challenge the diagnosis of BPD because I do not feel that I fit the criteria for that diagnosis. I never agreed with the diagnosis. I never felt that I fit the diagnosis fully. I believe that I was diagnosed with BPD solely because I self-harmed, and and back when I was diagnosed with it at the age of 18, self-harm and people who did self-harm sort of in their younger years were diagnosed with BPD quite frequently, and it was something that was quite common to be diagnosed with. So now I'm going to talk about my thoughts in hindsight. So now sitting here and having these thoughts about what happened in this A&E department and with this psych doctor, I think that both of these instances happened and were made worse by judgments. And I really do think that if this doctor had sat down and had listened to me and had more compassion and more understanding for mental health, I feel that he wouldn't have judged so easily and possibly would have listened to me a lot better. Also because a lot of mental health diagnoses do overlap. Things like BPD, bipolar, autism in girls, that all kind of overlaps. And the reason I say autism in girls is because a lot of autism symptoms in girls are very, very different to autism symptoms in boys. So I myself have been diagnosed with BPD, but I am actually currently waiting for an autism or ADHD assessment. So I was completely aware of the fact I was waiting for this diagnosis, and I personally do think that being autistic suits my behaviours a lot better, and a lot of the symptoms that I display now and in the past suit the diagnosis of autism. But obviously I am not officially diagnosed yet. I will probably have to wait another year before I can get diagnosed. But I wanted to just talk about some of the things and break down the diagnosis of BPD really quickly. So BPD is highly stigmatised, but when you think about it and you break down the diagnosis, BPD is as a result of unhealed trauma. And so by judging that person with BPD, you are causing more trauma, and they've already got this unhealed trauma. So please try not to judge people with BPD, because the judgments are causing more trauma. They already have this unhealed trauma that they are trying so desperately to heal from, and you judging them is causing more trauma. I have had to try to work on myself, and I'm currently in therapy, about halfway through my therapy, for a lot of the traumas I've experienced from doctors, from friends and family, from all these different things, and it is taking me a long time to find a therapy and a therapist that has worked for me. So please don't underestimate people with BPD. I am 27 now, but I started my mental health journey at 17. I have been unwell or have had unwell periods in my life for 10 years. And I feel that that is so underestimated when it comes to, oh, well, I can just judge this person. Well, you judge that person, you cause trauma. It may take them years to heal from that trauma. And I think that is something that a lot of people don't realise. So now I'm going to move on to some of my advice for people that are either being treated and they do have BPD, or they are being stigmatised, and also towards doctors and health professionals. So the biggest thing that I want to start off with is try not to let your personal judgments cloud your treatment of that person that you are seeing or that you are assessing. So the biggest thing is to listen to that patient, because their feelings are valid. And sometimes even just validating that patient and even just saying, it's okay to feel how you feel. Even just saying that can help the person to realise that they are safe and that they're not being manipulative. Or it can be a case of, they feel believed. And just feeling believed can help the symptoms a lot, because they can say, you know what, yes, it's okay to feel how I'm feeling. And to help them to realise that can really help the treatment and can actually help you to assess that person a lot better. So behaviours that seem manipulative might not actually be them trying to be manipulative. Behaviours might be as a result of trauma, it might be a coping mechanism, or it might be a result of poor communication and not knowing how to get their feelings across, and that may come across as manipulation, when in actual fact they don't want to manipulate you. There's another reason for it, basically. So my next recommendation is that if you as a doctor or health professional feel that you would benefit from some professional development, that you contact your senior management team and you do actually get some of that training, because videos such as this can give you a brief outline and can sort of explain it from a patient's perspective, but in actual fact getting that training, getting some extra like understanding under your belt, there's no harm in that. And in actual fact, a lot of managers will actually welcome you to go on training like that, because it will improve your understanding and ultimately improve your care and your treatment towards patients. So a lot of the time, patients want compassion. And I know that sounds silly. I know that, you know, with nursing, for example, one of the 6 C's that nurses follow by is compassion. And it can seem silly, but when you've been in the job for so long, you can lose a lot of your compassion and your care towards patients. And it can be very busy in A&E, I can imagine. And it can be as a result of, I'm busy and I don't have time. But actually giving that person 10 more minutes and asking someone else to do a job that you may need to do, like go and get blood results or something like that, might actually be all you need to stop that mental health patient from maybe acting out or, you know, becoming really violent or something like that. So I can't speak for everyone in this, but I know that when I have had a mental health professional or any sort of health professional sit down and give me 10 to 15 minutes extra of their time to truly try to understand how I'm feeling, I have really appreciated that, and I feel that it has helped me to actually calm down and to actually be able to kind of get on with, you know, my emotions and try to understand how I'm feeling. And the last thing that I want to say as a bit of advice is that mental health is very draining. So unless you've been through it yourself, or unless you have cared solely for somebody, like you have cared for a sister, a mum, a dad, someone in your family or a close friend, like for a long period of time and all the time, you won't really ever understand how draining the mental health mind can be, because someone with mental health doesn't ask for it, but they also can't just switch it off. Very much like physical health conditions, they can't just switch off how they're feeling. And if they're depressed, for example, they can't just suddenly wake up and be happy and just decide to be happy. That's not how it works. And it is very hard to understand that how draining this can be. And sometimes, as I have previously mentioned, these sorts of patients just need your time of day and they just need a listening ear. And sometimes these patients just want to talk to you, and sometimes they don't, but sometimes you can tell a lot from their non-verbal behaviour, and actually understanding how they're feeling is a big part of treatment and even just the care of that patient and giving them the right course of treatment. So whether that is sending them home to sort of get better at home, or whether that is referring them to the crisis team, or whether that is admitting them to hospital. Sometimes just spending a little bit more time with them can actually help you to understand what is the best course of treatment. So whatever of these things that you can give, whether it is your time or whether it is your understanding, any of that is better than judgment and basically treating them like, you know, they shouldn't be there or something like that. Because at the end of the day, mental health is draining, and mental health is not something that anyone asks for. So understanding that mental health is on par with physical health is a big part, and I wish that every doctor and nurse knew that, because it would definitely help the smoothness of A&E, and it would also help us mental health patients to feel listened to. So if you've made it this far in the video, thank you very much for watching, and I hope that I have given you some good advice. But that is it for today's video. Thank you very much for watching, and please remember that I believe in you even if nobody else does. Bye.
Just like you're young again, no, don't you cry. Just get back up again.